Drug abuse is a significant public health and social issue in the Philippines, affecting individuals, families, and communities. This comprehensive intervention plan aims to mobilize community resources, engage stakeholders, and implement effective strategies to mitigate drug abuse and related vice activities. Current state of drug abuse in the community. Recent studies shows that drug use, particularly methamphetamine or locally known as shabu, remains prevalent in urban areas. Data from the Philippine Drug Enforcement Agency or the PDEA reveals a burgeoning number of drug-related arrests and overdose cases. According to the 2020 National Household Survey on Drug Abuse, around 2.1 million Filipinos are reported drug users. Various barangays or villages reported high rates of drug-related incidents, often linked to poverty, lack of education, and limited access to health care and social services. Its existing programs. Government initiatives such as the War on Drugs have faced criticism for human rights abuses, necessitating a shift towards community-based interventions focusing on prevention and rehabilitation rather than solely enforcement. Key stakeholders and resources. First, we have the local government units or the LGUs. Barangay councils and municipal health offices facilitate local initiatives and provide funding. Second, educational institutions. Local schools and universities can play a role in awareness campaigns and educational programs. Third, non-governmental organizations or the NGOs. Various NGOs focus on drug rehabilitation, mental health, and community development. Fourth, healthcare providers. Local clinics and hospitals provide medical support and rehabilitation services. Fifth, civic groups. Community organizations and religious groups can disseminate information and mobilize volunteers.
Strategies for prevention. A. We have public awareness campaigns. Launch campaigns using traditional media like posters, radio, and social media to highlight the dangers of drug abuse. B. Educational programs. Implement school-based programs on drug education covering the effects of drug abuse, coping mechanism, and refusal skills. Next, we have conduct workshops for parents and recognizing signs of drug abuse and promoting open communication. C. Community outreach. Organize community fairs and events that includes resources for addiction, support, education, and rehabilitation. D. We have youth engagement programs. Develop sports, arts, and mentorship programs to engage youth in constructive activities and keep them off drugs. Measures to strengthen law enforcement efforts. Partnership with local police. This established collaborative initiatives between community leaders and local police to build trust and transparency. Or implement community policing strategies that prioritizes relationship building over punitive measures. B. Use of technology. Utilize data-driven approaches to identify high-risk areas and adjust enforcement strategies accordingly. Or employ anonymous reporting systems for community members to report drug-related activities without fear of reprisal. C. Community alerts and education. Conduct workshops to educate the community about their rights and how to safely report drug activities, promoting a sense of ownership. Enhancing treatment and rehabilitation services. A. Counseling and medical support. This provides community-based counseling services with trained mental health professionals to support individuals battling addiction, or offer medical assessment and treatment for co-occurring disorders. B. Rehabilitation programs. Establish accessible treatment facilities focus on evidence-based practices including inpatient and outpatient services. C. Reintegration programs. Initiate programs for recovering drug users including vocational training, job placement services, and support group to ease their transition back into the community.
Community education programs. A. Workshop and seminars. Run monthly workshop for various age group, focusing on drug awareness, prevention strategies, and healthy lifestyle choices. B. Collaboration with local media. Partner with local radio and TV station to discuss the impact of drug abuse and share recovery story to stigmatize addiction. C. Resource distribution. Create easy to understand pamphlets and materials that outline available community resources for preventing and treating drug abuse. Evaluation and monitoring. First one is data collection. Establish baseline data on drug use, prevalence, and continuously monitor changes through service and community feedback. Second one is stakeholder involvement. Involve community members in evaluating the effectiveness of interventions to adapt strategies based on feedback. And the last one is regular reporting. Publish findings on progress and obstacles to maintain community engagement and stakeholder support. This comprehensive community-based intervention plan is designated to reduce drug abuse and vice activities by addressing prevention, enforcement, treatment, and community education holistically. By leveraging local resources, fostering partnerships, and encouraging community involvement, we can create a healthier, drug-free environment for all community members. Presentation materials. Prepare visual including graphs of statistical data, infographics summarizing case strategies, and testimonials from community members involved in existing programs. This plan can serve as a guide for community leaders, local agencies, and stakeholders in effectively tackling the overarching issue of drug abuse in their local communities.